Basically, I tore from the vagina where the baby comes out, a vagina straight through into the back passage.
First of all, I started having problems with my bladder. It was a constant need to go to the toilet, just a constant urge.
85% of women suffer some degree of perineal tear during their first vaginal birth.
I didn't consider it to be a traumatic experience because my baby was born at the end of it. But actually, when you do think about it, it was really traumatic.
The advice I was getting was this will get better and you will heal, and that wasn't what was happening to me.
In some cases, tearing can lead to long-term complications.
It can lead to relationship breakups. Women tend not to go out. Quite often they may leave their job because they're so embarrassed.
These conditions affect more women than we know. Injuries are sometimes missed, and often women suffer in silence.
It's not something that you talk about openly.
Why didn't you want to tell people?
I didn't feel normal. Was it because my body wasn't capable of giving birth?
I've definitely felt ashamed.
Ashamed of what?
Of what happened to me and what I'm living with on a daily basis.
Yeah. Bye-bye. Bye-bye.
Hi Debbie,
Hello,
Jean, how are you?
Good, thank you. Well,
Nice to
a bit
meet
drowsy,
you.
but I'm
Yeah,
all
how are
right.
you feeling?
Yeah, I'm not too bad, thanks. A bit drowsy, but I'm all right.
6 years since Debbie gave birth to her son Caden, and she's lost count of how many hospital appointments she's had.
I tore, basically, from front to back. There's a small area between your back passage and your vagina, and that was quite badly torn, like all the way through. I went for emergency surgery to try and repair that, but when we got to emergency surgery, it seemed that it is actually cut into my bowel.
Surgeons repaired the tear, but Debbie was left with a small hole between the wall of her vagina and her bowel.
I was passing wind uncontrollably through the vagina, and every time I went to the toilet, there would be faeces coming from the vagina. So it was just, I was constantly in the bath, constantly washing, causing all sorts of irritations.
A number of attempts were made to repair it, but none successful. So Debbie was fitted with a colostomy bag.
Everything changes, I have to consider it wherever I go. If I leave the house, I take spare clothes. I have to scan the place for the nearest toilet. For example, I was at shopping in Asda, standing in the queue, and I just went, and the bag came apart from the sides, and I could feel it leaking, and I could smell it, so I had to kind of run and drag Caden kicking and screaming behind me because he didn't really understand what the urgency was. That's happened when I've took him to school. It's happened while I've been at work. It affects everything you're doing, really.
What was it like dealing with this injury whilst raising a newborn baby and now a 6-year-old son?
It's a lot to take in, it's overwhelming as it is, and then when you've also got a stoma bag to look after, you're changing stoma bags in between nappies and bottles, and it was exhausting. I'd say I hardly left the house.
Debbie's tear was classed as a 4th degree tear, which is the most serious and rare. Not all tears will lead to complications.
In this perineal model, you can see the vagina and the back passage. When the vaginal skin is torn, it is called a 1st degree tear. When the underlying muscles are torn, it is called a 2nd degree tear. And when the anal sphincter muscles are torn, it is called a 3rd degree tear. And when the skin lining the back passage is torn, it is called a 4th degree tear.
I suffered a 3rd degree perineal tear when I gave birth. This has left long-term problems. I have a degree of bowel incontinence. I don't have any sensation in my bladder, and I have nerve damage, which causes quite a lot of pain. I remember doing my first walk with the pram, and I was able to walk for 10 minutes, and then I remember sitting down on the curb and saying to my mum, I can't actually walk any further, what's going on? I'm in a lot of pain. And she just said, you know, that's fine, we'll turn around and we'll walk and we'll go back home. But that's a really clear memory for me because it was about 4 weeks out then. And I thought I should be able to walk 20 minutes with the pram.
Over the next 3 months, Jenny's symptoms got worse. Because the tear had damaged her nerves, she now has no sensation in that area.
I have to wear a pad all the time, and it's the psychological distress really of constantly feeling uncomfortable and dirty. It distresses me every time I go to the toilet. It's the daily dread of just having basic bodily functions, which over time really starts to take its toll on your coping strategies really and your mental health. It's obviously really difficult in an intimate relationship to deal with symptoms in that area.
Recent research found the amount of women suffering serious 3rd and 4th degree tears had tripled over the last decade, from 2% to 6%.
Women are becoming heavier, babies are becoming heavier, and women are delaying their first pregnancy till they are much older. And these are all risk factors that actually increase the rate of tears.
Diagnosing these injuries quickly and repairing them properly is crucial. It can make the difference between developing a complication or making a full recovery.
What's an apex? The beginning of the tear, remember? So the beginning of the tear. So you want to go a centimeter above that and on the other side. Make sure that you go as deep as possible, because if you don't bite deep, you may end up with a pocket, and that can also create hematoma.
Adelaide is a specialist midwife, and concerned that mistakes were being made, she set up this course to teach other midwives and doctors. How do you think training is at the moment for midwives?
It's quite patchy, so it's not standardized. If 10 women are going to have a baby and 8 of them or 9 of them are likely to have a trauma, then we need to have mandatory training across board.
How do you feel when you have to repair these injuries?
The unit's busy. You've got another woman waiting, for the bed, for a bed, and you do feel under pressure.
Do you feel that there needs to be more training in hospitals for this?
Yeah, I wouldn't say the training is very good, and you have to pay for courses like this.
Within that, the trust, we have like a mandatory study day where suturing is covered for about an hour.
It's not something that's taught very well when you're a foundation doctor.
How does that make you feel when going into that situation?
Very nervous, yeah. I'd be afraid of making a mistake or getting a bad result for the woman.
Keep holding this and then use this. And you see I'm holding this so I can have the tension and I will press it down.
How important is it to get this right for women?
I can't emphasize enough, because if we don't get this right, it means it's affecting women's general way of living. It's affecting their relationship. For example, if they are in excruciating pain, that might lead to relationship breakdown. What can be worse than that? Obviously, if it's a labia tear, you might want to shorten that a bit, yeah? So it's not too... Because sometimes
These injuries affect more women than we know because many suffer in silence. Either they're too embarrassed to seek help, or they're unsure whether their symptoms are a normal consequence of giving birth. And too often, when they do seek help, their concerns aren't taken seriously.
I was being told that this was normal after a baby. I was told that at one point, there's more to you than this, Jenny. They were the exact words. That it was all in my head.
What did you think when you were hearing these things and you knew that you weren't okay?
Part of you starts to believe it. You start to think, well, is it all in my head? And you walk out of the appointment and you try and wish it away. You try and pretend it's not there. And obviously, you wake up the next day and it's still there, and I just think, where am I going to go to get help for this? Because nobody believes me.
turn around, this leg, the other leg, turn around.
Has it made being a mum harder?
Definitely. The stoma bag takes up a lot of my time, and he's well aware of that as well. If he needed my attention, I was in the toilet or the shower, and he has lashed out and hit out. So we do have therapy sessions for him to come to terms with that. You know, it's not that mummy don't love him. Sometimes my attention's got to be elsewhere.
For both women, their injuries have been life-changing. Debbie is still dealing with depression.
Our confidence is very low. I used to be quite out there. I'll be the first one you heard walking through the door. I wouldn't say it's changed my personality completely. You know, my personality is still there, but confidence, I don't have any. Like, you know, when I think confidence, you need confidence to do your job. Reality of it is I don't do my job properly because of the confidence. Confidence is where putting on some clothes and walking out the house and feeling lovely. I don't really get that.
Debbie's relationship with Caden's father ended a year after his birth. For Jenny, who was a single mum, postnatal depression hit hard, and her son now lives with his father.
I didn't feel I had anything left in me to love or to mother. I just felt so devastated by what had happened to me. The trauma of it all wrapped up in a parcel was just overwhelming, and I felt so angry that it had happened to me and that I couldn't mother in the way that I wanted to and be the person that I was before I had Thomas. I couldn't. It had changed my sense of self and it just shot my confidence so much.
With such devastating consequences, the question now being asked is, can anything be done to stop these injuries from happening? For the last couple of years, a team here at Croydon Hospital has been working to try and reduce the number of these injuries, and I'm here to find out what they've learned so far.
Communication with the woman is vitally important so that she doesn't push as the baby's head comes out, but actually pants to prevent the head from popping out.
Can you just demonstrate to me this new technique that you've developed?
So the technique essentially consists of placing 3 fingers firmly on the perineum, then the thumb and the forefinger on either side of the baby's head. Then as the baby's head comes out, the other hand is used to prevent the head from coming out with great force. You continue to support the perineum as the shoulders come out, because tears can also occur as the shoulders are being delivered.
So what difference have you seen since you've been doing this technique in the injuries that you've been seeing?
So there has been a reduction in severe 3rd and 4th degree tears in our institution.
And why do you think it's working?
When you do the manual perineal protection, you are actually preventing the weakest point of the perineum from tearing.
This is one of a number of new techniques which doctors and midwives have developed together. They'll be piloted in 16 hospitals from January. For now, though, everyone agrees there must be more awareness of these injuries. Women need to be told more about what can go wrong during birth and know when to seek help.
It is something that we need to talk to women about in the antenatal period. I think it's a subject that's not broached very frequently.
I think you need more choices. Definitely they need to have the option and understand what can go wrong.
Women need to understand that there can be consequences after vaginal delivery, that help is available. They need to be less embarrassed to talk about this, and as healthcare professionals, we need to be less embarrassed about these symptoms as well.
I've lost a lot. And it's really hard to think that if I would have just had a bit more knowledge about birth and perhaps been given a bit more control, how different things could have been.